Lads, listen up. You need to watch this if you and your partner are trying to have a baby and you're shooting blanks. In this video, I will tell you what to do if you think your swimmers aren't performing and all about infertility treatment options available to you if you have Crohn's disease or ulcerative colitis. Welcome back to my channel, the only place for Crohn's and colitis tips, tricks and information. So make sure you hit that subscribe button and hit the bell to be notified every time I post a video. And if you want to join an exclusive community of people who receive tips and tricks on living with Crohn's disease and ulcerative colitis, make sure you sign up to my newsletter by visiting the link in the description box below. Now in this video, I'll be going over some of the techniques used to help couples conceive a child through the use of IVF, which I used to work in after completing my master's in reproductive medicine. So the very first thing you do if you've been trying to get pregnant with your partner for a long time is to actually go for a fertility test. What this will involve is seeing a specialist, and the way they can determine your fertility is by looking at your sperm concentration, morphology and motility. So to simplify that, concentration of sperm is looking at the amount of sperm there is within your ejaculate. A high concentration will give you a better chances of getting your partner pregnant. The morphology is looking at the shape of your sperm. If they are normal shaped, then that means they are not defective, and the more normal shaped sperm, the better your chances are of getting your partner pregnant. And lastly is the motility, which is the movement of your sperm. If they are normal, the sperm will move in a quick swimming fashion, but some can move fast, slow or not at all, as well as determine the direction they are moving in, as some can swim around in circles. So onto fertility preservation, and this is simply where you can get your sperm frozen and stored. Lots of men do this who undergo radiation therapy for cancers of the pelvis and prostate. Right, so if you and your partner have gone for IVF to essentially get pregnant, then what will happen is your partner will undergo treatment so she can start ovulating. Then all her eggs that she produces in that cycle will be collected and matured in the lab, selecting the best one for your sperm. Now before this, your sperm would be gone through a selection process where the best ones will be selected for fertilization. If your sperm aren't the best, they can still be used, and I will come on to how in a moment. So fertilizing your partner's egg can happen in a number of ways. The first one is through IVF, or known as in vitro fertilization. This is where your sperm and your partner's eggs are mixed together in a petri dish and your sperm fertilizes the egg naturally. But this requires your sperm to have good motility and morphology. Another option is having intrauterine insemination, where your sperm is physically placed inside your partner's uterus to facilitate fertilization. With this option, your partner's eggs are still inside her, and all this does is just helps bypass all the female's natural defenses against sperm, giving you more of a chance to fertilize the eggs with your sperm. Now, if your sperm aren't the best shapes or movers, they can still be used, as the best version of those will be picked out, but you are more likely to have something called intracytoplasmic sperm injection, or ICSI. What this involves is just getting a single one of your sperm and physically injecting it into the egg while it's in a petri dish to help fertilization occur. Now, a lot of people do fear that they may pass on their IBD to their child, and if this is one of your concerns you have, then make sure you watch this video as I cover that in a lot more depth in there, and the link to that is in the description box below. So to summarize, if you want to preserve your fertility for the future because you're worried what the effects treatment may have on you, or if you're not sure if you want kids and want to have the option to decide later on, then freezing your sperm is the best way to go. Now make sure you check out these videos on more useful tips, tricks and information for Crohn's and colitis. Hit that subscribe button and the bell to be notified every time I post a video, as well as leaving a like and a comment if you enjoyed this and found it useful, and I can't wait to see you in the next episode.